Hi, everybody. My name is Matthew Estrad. I'm a gerontologist in St. Tammany Parish, and I have been partnering with the Council on Aging in St. Tammany for over 10 years. Most of that time, sorry, all of that time as the caregiver support group facilitator each week, and also sometimes as an educator and consultant. And for the last 5 years, I've been bringing you caregiver coffee, small bits of information for the aging journey, whether it's you yourself that are aging or a loved one or both of you. Um, for example, this week or today, we're going to be talking about in-home services for aging. So services that can be performed in the home to help you stay in the home as long as possible, and sometimes as long as it makes sense. So we'll talk about at least three of these different services that may sound familiar. Maybe you've probably heard of them before, but you may not understand the nuances and differences between those. So we will get into that here in this video. So thank you for being here with us. And if you end up liking this, please, I hope that you will share this on Facebook, on YouTube, email, however you want to do that. I hope that you feel moved to do that. Before we get into our main topic of these in-home services, just want to tell you a little bit about our caregiver support group. We meet every Tuesday evening of the year, unless that Tuesday is a holiday, like Mardi Gras, for instance, and in which case we move that to the Thursday in the week. If Christmas falls on a Tuesday, you kind of get the picture, 4th of July. So, and that is why while we meet every Tuesday, it's important to know which Tuesdays we're not meeting. So, every 2 months we publish a new calendar that tells you where we're going to be on what dates, and if there's any kind of change off of a Tuesday, or if I happen to be out of town. Sometimes we postpone groups for that reason too, but it's very, very rare. So the basic pattern of the support group is within a month. The first Tuesday of the month, we're in person at the Slidell Activity Center. The second Tuesday, we're on the Zoom platform. So just kind of I'm recording this via Zoom. And if we were in a support group, you would kind of see me in this window talking, discussing things with you. But people can also join by their tablet or smartphone, or they can even use their smartphone or even landline phone to call in and just treat it like an audio conference. So that's the Zoom platform. The third Tuesday of the month, we are in person at the Covington Senior Activity Center. And then the fourth Tuesday of the month, sometimes the fifth Tuesday of the month, if we get approval, we're meeting on the Zoom platform again. So this is a format that we went completely virtual during COVID. When things started getting back to normal, we went to this hybrid model, and people seem to like it because a lot of people want to meet only in person, and some only want to meet, and many people only want to meet on Zoom because of the convenience, not having to leave a loved one if they're taking care of them. And some people enjoy going to both of them. So, however you want to join us and however often you want to join us, please know that we're here for you. If you're interested, you can go to the Coast website, coastseniors.org, and you can navigate your way to the caregiver services. You can find the calendar, and you can also find a way to join the email list. So you get free private email list, and you'll get an email every week, a reminder that we're meeting. And then when a new calendar comes out, you have access to that. All right. So, and of course, you can contact any of the Coast centers if you have questions about the support groups, and just ask for caregiver services, and they'll write you to somebody at Coast to answer his questions, and sometimes those questions get routed to me. My phone number is on that calendar as well, which you can find on the website. The calendar that is not my phone number. So if you can get my phone number off the calendar, you can certainly shoot me a text or give me a call with any questions. All right. So with that housekeeping out of the way, let's talk about in-home services. So we're going to talk mainly about three different types. There is respite or non-medical sitters, and then there is home health, and then we're going to talk about hospice. We'll talk about all three of those, and if we have time, we'll kind of go into some other things that are different, but they're still provided in the home. All right, so the first one we'll talk about is the I guess not the least restrictive or the least serious of them because it's non-medical, and that's in-home sitter or respite services. The word respite is simply means a break. And most of the time when we say respite, we mean for half a day or a day, but it can be multiple days during the week. So respite it allows a caregiver to be able to sits there and watches and interacts with someone who otherwise it wouldn't be safe for them to be left home alone for various reasons. It could be because of dementia, or it could be because of a mobility issue. It could be that they need help eating or having meals prepared. But we know that it's not safe for them to be at home, but the caregiver um, needs to get out, whether these are absolute necessities like the grocery, their own doctor's appointments, or it could be just the simple break that so many people they really need so they don't get burned out. Now, of course, you can ask family members to relieve you and provide that respite. I certainly encourage that. Ask your family, ask your friends, ask your church if they have volunteers for that. So that's probably the first thing I would go to and I would recommend. But if you've exhausted that or you're not getting anywhere with that, certainly it might be time to bring in respite. Now, there are a couple of sources of respite and one important thing to know is this is private pay. Typically, insurance, unless you have a really good long-term care policy, you're going to be paying out of pocket or paying cash, fee for service to have a sitter come in. And so, so that can be through an agency. Um, I'm not going to name them per se, but you'll recognize the names. You'll see billboards. You might hear ads for them on the radio. But these are in-home, non-medical companion services, respite, sitter services. They usually use any of or all of these names. So they're agencies. There are also private duty or people who they themselves they advertise themselves. They don't have employees per se. They don't have an agency, but they themselves hire themselves out to families. And then sometimes there is the availability, the eligibility, receive respite through the Council on Aging in St. Tammany. And when they do it, they're actually hiring an agency too, except when the funding is there, the Council on Aging is paying that benefit for the family, paying the agency for the family, and then you have some Medicare Advantage programs that offer respite also when there's a certain diagnosis, for example, dementia. So the services are pretty much the same. They're non-medical, mainly companion services with some extra things that we'll talk about. But it is fee for service, whether you're paying out of pocket or you have some kind of policy or organization that is able to cover that. It can be, there are also grants out there. I'm not sure I believe these are like national grants. Um, and we can talk about that if you come to the support group. I might have some ideas about what those organizations are. So, so typically, not always, and this is why you're going to interview the particular agency or person, like solo entrepreneur person that you are considering for this. So you're going to want to find out what they charge, what minimums there are, such as how many it might be. There might be a minimum of 2 hours per day or 4 hours per day, or it might just be a per week. It might be like 8 hours per week, but then they can break it up. So that's just something you're going to want to ask because some agencies might be very flexible and be able to come and do 2 hours here, 1 hour there. I can't attest to who that is, who could be that flexible, but they tend to want to be 4 hours. Um, but you'll just interview, like I said. And then also you'll also interview them and ask them about their training. You'll ask them about what other services? Some do light housekeeping, some help prepare meals, some will take the person to a medical appointment, and and that could be in their vehicle or it can be in the client's vehicle. So you want to ask these questions up front, um, and also know how to reach them if there's an emergency, or what do you do if someone who was scheduled to be there calls off? Are they going to send someone else to take their place, or are you kind of in a tough spot as a caregiver where now you can't leave because the help is not being able to come because they were ill. So there's lots of things to a lot of questions, a lot more than that, but those are just really just like the basics I think make a lot of sense. And you'll think of good questions too when you're meeting with them. You'll want to ask them, how do they, how did the sitters become accustomed to the loved one? Or sorry, I should say that the other way around. How do they recommend that the client, let's say they have dementia and they're the ones that are being accompanied, how do they usually get used to the sitters? Like there's usually some strategies on how they recommend doing that. So, one thing I want to mention is if you go with a private duty, like an individual and not an agency who is then hiring and training, you want to make sure that that person who is a sitter, they have insurance. You want to know what kind of training that they've gone through, what kind of experience they have, what happens if they have to call off, if they're sick. Do they have someone else? Maybe even if they don't have a company, maybe they have someone who they trust to take their place, and would you be okay, and you got to decide, would you be okay with that person who might be filling in if that staff member, if that sitter went on vacation or was sick. So these are things to consider when you're looking at respite services, also known as sitter services or companion services. All right, so that's the first one that we're wanting to cover. That is those services I just mentioned. Next is home health. Okay, so home health is very different. Home health is typically paid for by insurance. And because of that, it typically needs to be prescribed by a doctor or a nurse practitioner or a physician assistant. But the point being that it's a prescription because insurance is going to be paying for it, and it's typically after a discharge. It could be after a hospital stay. It could be even after an outpatient surgical procedure where you're not staying overnight, but you come back home to heal up, but you still need services. So home health may be prescribed to do that, to come change bandages. It might include under the umbrella of home health. It could be a physical therapist. It could be an occupational therapist. It could be a nurse. And what they're trying to do is take care of you and help you transition to being out of the hospital and back to a certain point, a certain level of health so that you can then take care of yourself with family members. So it's not just a sitter service. They're actually doing things on a medical basis. So wound care, um, changing dressings, checking the health status, et cetera. So when home health is prescribed, sometimes they also have personnel that are able to bathe a loved one. So, but again, that they're not there to bathe, but they are there, and that might be another service that they provide. But strictly, the bathing is not it by itself come with home health. It comes with other medical things. So that's important to know. Um, just like with the respite services, even though respite is out of pocket, still with home health, even though you have insurance typically paying for that, you have the right to interview and choose you are going to use. A clinic, office, or hospital may suggest or give you a set of numbers, and you can call them, but you don't have to use anyone that they told you about. They certainly can't tell you who to hire. This is your choice. So it's important to know that while they might make recommendations, they can't tell you who. Um, and then that brings us to the third service I'll talk about for in-home, and that is hospice. So yes, hospice is when is prescribed by a doctor again, prescribed just like home health, but it's prescribed when that person, when in the medical opinion and clinical judgment of that provider, they feel like the person in front of them has uh, 6 months or less to live, and thus that gives them the autonomy to prescribe hospice. Now, hospice is a medical benefit, it's part of Medicare, and certain things come with that. Um, Typically, hospice is not curative, so they're only going to give certain medications for certain things. They're not Hospice is not to prolong life, but is also not to hasten death at the same time. That would be immoral. That would be unethical. So the basic idea of hospice is comfort care, but not curative care. They're not trying to cure the cancer any longer or cure the dementia or have treatments for the dementia. They'll be doing things to help the person be comfortable, and it all should be done in an ethical way. And Typically, a person, when they go on hospice, they no longer are under the responsibility of their primary care physician and others. They are typically under the responsibility of the medical director of the hospice company. And with that, they will be under the care of nurses, nurse practitioners, and others that come in that do the bathing that may help to feed. And this is in addition to the family still coming in and providing some care as well. They may be helping someone eat. Uh, um, the family, many times it's very special for the family and close friends to be able to do those very intimate tasks near the end of life. So, um, and so that is hospice care. A benefit that not many people know about with hospice care is that the caregivers are entitled to an extended respite. So, like even up to a week, where this might mean that the loved one who is on hospice is goes to a nursing home or skilled nursing facility, and they are there for a week while the caregiver gets a break or works or does something like that. So it's just something that you'll see if you look online on the official Medicare website. That's one of the benefits. So you just need to ask about it, even if like if that's something that's useful, you need to ask about it. And actually, when you're interviewing the hospice companies, you want to. That's one of the questions you want to ask them about is if you would need, if you ever would like to take advantage of that benefit of a week of respite. How do they handle that? Do they have certain facilities that they partner with to do that? Other things to ask the hospice company are about how they respect different faiths and how they attend to the specific needs of your faith. You want to verify the medical director is now in charge of the care of the person on hospice. How do you reach someone in an emergency? How would you reach them if for some reason the person um, start had a medical emergency? Are you to take them to the emergency room? And typically not. That's not what happens during hospice typically. Someone has to usually has to come off of hospice to be able to go to the emergency room because just depending on what's going on. So these are all things that you want to clarify and talk to different hospices and see what their personality, and I mean like their culture and personality of the hospice. Some are lean towards a certain faith, some do not, and you just want to know their philosophy and how they handle emergencies and how they're going to treat your loved one, and how their view of hospice and that time of life. So, last thing I'll do is to parse out and say what hospice is not. Hospice is not palliative care. Hospice is actually a subset, a small piece of palliative care. Palliative care is a medical specialty that is helping with comfort and helping with symptom control while also working on a cure. So you can think about when we talk about like the life course um, from birth to death. Palliative spans that whole time. Think about pediatric cancer patients. They're receiving palliative care. They're receiving their cure and their treatment, and they're receiving comfort care. So they're in palliative care, but not in hospice. because they are still receiving care. And it could be even someone middle-aged or even someone older can be on palliative care and not yet on hospice care because death is not imminent. It's not expected in the next 6 months. So when someone recommends or talks about palliative care, please don't be afraid. That is a medical specialty. It doesn't always mean, it usually does not mean end of life. It's really symptom control and an extra layer of support. So keep that in mind. So we just covered in-home services such as respite, also known as companion care or companions and sitters. We talked about home health and what that means. That's prescribed by a doctor, it's paid for by insurance. And then we finished up with hospice and palliative care, hospice being a benefit that can be, I should say, in the home. It could be in a facility or it can be in a hospital. So it can be multiple settings. And typically the choice of the person who's on hospice where they want to be and receive that. So I hope this has been helpful. Of course, you have to interview these companies that you receive services from and choose the right one. And I hope that I've given you enough information to kind of know the difference between these three big services and what to ask for, what to expect, so that you can make good decisions that later on, when the season is over for you, you look back and you feel like you made some good decisions, you did the best that you could, and you informed yourself as much as you could. So thank you for being here, sticking around for this video, and I look forward to seeing you and you seeing me on future Caregiver Coffees. Take care.